Hi, I'm Dr. Victor Dolan, and I know that your most precious asset is your good health. I also know the best way to attain and maintain that good health is naturally, through diet, lifestyle, exercise, education, and information. And that's the point of this show, Good Health Naturally, to give you information about things you can do to make yourself healthier, to maintain your health, to attain health. Even just before the show, talking with people, it's amazing what a 20 or 30-pound weight loss can do for you. It's amazing what a quitting smoking can do for you. It's amazing what 20 minutes a day, 7 days a week of exercise can do for you. But that can all help you attain good health naturally with no side effects other than health and feeling better. No matter what age we are, even into our 80s and 90s, people in their 80s and 90s were tested, and people who were couch potatoes started doing exercise, weight-bearing exercise, resistance exercise, and they gained muscle. And gaining muscle sets off different hormones and a different cascade of effects in your body and helps you mentally, physically, and even older people got stronger and more mobile with simple exercises, simple weightlifting or walking or swimming. Today I'd like to talk about osteoarthritis, the most common arthritis. The arthritis people usually mean when they say, I have arthritis. In their hands, in their knees, in their feet, in their hips, in their spine. Osteoarthritis to the chiropractor is a very common presentation. Much of our office is made up of people with arthritic changes, osteoarthritis being number one. And then, of course, there are other forms of arthritis, psoriatic arthritis, rheumatoid arthritis, which may benefit from an adjustment or from the different modalities available to us. Well, let's go to the video.
Osteoarthritis occurs when the joint cartilage erodes and the bones begin to grate against one another. Bone spurs are protrusions that can grow from the bone as a result of this constant friction. Osteoarthritis can affect any joint of the body, but it is most prevalent in knees, hips, big toes, spine, and hands. Osteoarthritis has no cure, but there are a variety of options to treat the disease. If the disease is caught early and there is just some wear and tear, some of the joint can be preserved through simple but consistent lifestyle changes. Oral supplements like glucosamine sulfate can help the body repair the damage or increase synovial fluid in the joints. Anti-inflammatories will temporarily relieve pain, but probably speed up the process of joint degeneration. For overweight individuals, it's important to reduce sugar, including bread, rice, and breakfast cereals, which helps to lose weight and reduces inflammation. Sugar itself produces inflammation in the body. Riding a bicycle for 5 minutes 4 times per day improves circulation in the joint, and Pilates is good for muscle strength. Medical interventions are also an option if the cartilage is completely eroded and the joint's bones are rubbing together. Anti-inflammatory hormones like cortisone can be injected to reduce the pain temporarily, but they make arthritis worse over time. Over-the-counter pain relievers like acetaminophen or paracetamol can be used, and when they aren't enough, a doctor can prescribe a mild opiate like codeine to help with the pain. As a last resort, arthritis patients may turn to surgery to replace the bad joint with an artificial metal or ceramic joint. In recent years, platelet-rich plasma therapy and stem cells have been used to reduce pain and repair some of the damage caused by osteoarthritis to avoid or delay surgery.
Osteoarthritis, or all arthritises, are in part aggravated and brought on by inflammation. And if we can keep inflammation down in our body, we can keep down the pain of arthritis. If we can keep inflammation down in our body, even our blood vessels, our heart, our lungs function better. If we can keep inflammation down in our body, the damage that the inflammation does can be kept to a minimum or hopefully halted. On to 5 minutes into the show and on to osteoarthritis. Osteoarthritis has many synonyms or many terms that mean pretty much the same thing. In the chiropractic office, degenerative disc disease, abbreviated DDD. Maybe your doctor sent you out for x-rays and put down rule out DDD or rule out OA, osteoarthritis, or rule out DJD, degenerative joint disease. Nowadays, DJD is pretty much an old term, and only an old guy like me uses DJD, degenerative joint disease. But these are, it's a common diagnosis, a common condition, and it usually means bone spurs, joint space narrowing, calcium deposits. All of that is a part of osteoarthritis. Osteoarthritis, in part, is a mechanical problem. Osteoarthritis, the most common arthritis, comes about from kinks or malposition, misalignment that puts stress into our joints and degenerates those joints faster than should, quote-unquote, normally happen. In my office, in many offices, there are people well in their 70s and 80s that have a minimal amount of arthritis, osteoarthritis, or no arthritis at all. And yet we also have patients, chiropractors, physical therapists, medical doctors, have people in their 30s and 40s that are already needing joint replacements because of osteoarthritis. The arthritic degeneration can be accelerated by diet, can be accelerated by injury, can be accelerated by genetics, but that's something we can't do anything about. What we can do something about is our diet, our lifestyle, the exercises we do, the supplements we take, and whether or not we inflame our body, whether or not we inflame our joints and cause further destruction, whether or not we have inflammation and cause the aches and pains that are associated with that inflammation more so than the condition of arthritis. I'm sure you know people in their 50s, 60s, 70s, and 80s who are active and who do have arthritis, yet they're able to function. They're able to golf or even play basketball or do fairly vigorous exercise, vigorous lifestyles, and they have a minimal amount of pain. And yet we also know people who are younger, even without arthritis, but they inflame a joint. Maybe they do too much, and the inflammation is the enemy. So arthritis, osteoarthritis, degeneration of our joints is different in each patient. Some people can't function, and some people run marathons even with a diagnosis of arthritis. If we do the right things, nutrition, diet, appropriate exercise, chiropractic to keep that alignment properly, we slow or can stop degeneration. If we do the wrong things, if we eat fast food, if we smoke cigarettes, we can inflame our bodies, get a systemic inflammation, and also get a particular joint inflamed. The course of arthritis, like the course of many diseases, is highly variable. Some patients with DDD, degenerative disc disease, or DJD, degenerative joint disease, osteoarthritis, literally cannot walk. Yet other patients with similar x-rays or MRI findings may be able to run marathons or lift heavy weights. Some people suffer for only a few days with pain and symptoms. Some people suffer for months. That's one thing that people should realize. Many aches and pains are episodic. They come and go. Many people come to an office and they say, oh my God, my back, my knee, my elbow, my nose, whatever, is hurting like heck. I can't live like this. The pain is horrible. Well, luckily, most pain, musculoskeletal pain, is episodic. It's due to an inflammation of overdoing it, or perhaps a single instance of lifting something heavy, or an improper posture, or a car crash, or a fall. If we get over that inflammatory state, then the aches and pains can go away. So an anti-inflammatory lifestyle is very important for all of us. Inflammation is the cause of so many of our aches, pains, symptoms, and diseases. If we can keep inflammation down to a dull roar, we'll be much healthier and live more pain-free. In the spine, there's a entity that chiropractors and osteopaths in particular, and physical therapists and massage therapists look for misalignment, and chiropractors call it a subluxation. In the spine, we can have something called spinal subluxation, which includes spinal kinesiopathology. This is a fancy way of saying the bones of the spine have lost their normal motion, their normal position. It restricts your ability to turn, bend, move. The spinal kinesiopathology, the misalignment, the malposition, the kink, the twist, sets into motion the other four components. Neuropathophysiology, improper spinal function that can choke, stretch, irritate, inflame delicate nerve tissue. The resulting nerve system dysfunction, wherever that nerve goes to, for instance, sciatica, a pinched nerve in the low back, or pinched is not a technically correct term either, but an irritated, inflamed sciatic nerve goes down your leg, and your leg doesn't function right and hurts. A pinched nerve in the neck, again, that's not a good term, pinch, but an irritated or inflamed neck can go down to my fingertips, can cause pain, numbness, weakness. Actually, weakness comes about faster, sooner in a problem than pain or other dysfunction. You can go to a physical therapist, a chiropractor, a nurse practitioner, a physician's assistant, or your MD, and there are different tests, for instance, grip strength test. And if you have a nerve that's irritated on one side, I may only be able to close my grip to 80 pounds of pressure, whereas on the other side, I may be able to close at the unirritated, non-problematical side, you may be able to go to 100 or 110 pounds of pressure in the grip strength. Strength disappears first before pain comes about. Pain is one of the last thing that comes about in a problem. But anyway, back to the spine, spinal kinesiopathology, sending in spinal neuropathophysiology. This also includes myopathology. The muscle supporting the spine can weaken, atrophy, become tight, go into spasm. The resulting scar tissue changes muscle tone. And that's why sometimes people have to wear a brace, or sometimes they need to see the physical therapist 3 times a week for 4 or 5 months, or why they have to go to a chiropractor for repeated spinal adjustments. That spinal subluxation can result in histopathology, a rise in temperature from the increase in blood and lymph supplies resulting in swelling and inflammation. Swelling is part of the components of inflammation. Inflamed discs can easily bulge. An inflamed disc can easily herniate or tear. It's at a weakened state. We want to live an anti-inflammatory lifestyle. An anti-inflammatory lifestyle is anti-disease, anti-aging, anti-disc herniation, anti-aches and pains. And I'll get to the nutritional aspects of fighting inflammation in our body, as well as what we should avoid, like fast foods, processed foods. These are all things that are artificial and foreign to the body and increase our inflammatory chemicals in our body and increase our aches and pains and increase our degeneration into old before our times. From histopathology, we can move into pathophysiology. The vertebral subluxation contributes to osteoarthritic degeneration. Bone spurs, abnormal bony growths attempt to fuse malfunctioning joints. The spinal decay, scar tissue, long-term nerve dysfunction can cause other symptoms in the body to malfunction. Now, this misalignment, which sets off chemical changes, which sets off remodeling of the tissues of the joints, in part is at least a mechanical problem. If the front end of your car is out of alignment, the parts wear out quicker, the tires wear out quicker. When the front end of your car is in proper alignment, the tires last longer, the ball joints or whatever's underneath a car nowadays last longer. Proper alignment, mechanical alignment in your car is similar to proper mechanical alignment in the joints of your body, whether it's the spine or a knee or a shoulder or a wrist or an elbow. Proper alignment is important in the proper functioning, the smooth functioning of that joint. And that's why people sometimes need to see a chiropractor or a physical therapist to make sure that joint is properly aligned. Not just not dislocated, which is a major observable phenomena, but sometimes it's only slightly misaligned. And somebody will say, oh, my elbow's stiff or my shoulder's stiff, and it may need an adjustment to put it back in proper motion, proper alignment. So that's the mechanics of osteoarthritis, in particular for the spine, but all joints. The good news is an anti-inflammatory regimen is anti-arthritis, it's anti-aging. The bad news is there is no bargaining in your good health. You can't wish it away. You have to take action. And the action is not that difficult. It's not that hard. But there's no bargaining in health. There's no deals to be had. You want better health. It will take a little effort and energy on your part. No doctor, no therapist of any kind can undo the things you do every day. Your habitual postures, the habitual movements, the diet that you eat. You have to avoid the bad and do the good, and you will feel better, have less pain, live longer and healthier. Now imagine how bad it is if you did everything wrong. Imagine how good it could be if you did everything right. Osteoarthritis, or joint deterioration. Osteoarthritis is a progressive and can be severe disease. We've all heard of people crippled by arthritis. We've seen people bent over, bent, crooked, limping along with arthritis. And there are joint replacements at the end point of arthritis, surgical procedures to replace our parts when things get bad enough. But usually, simple prevention is easier than those cures. Replacement parts are usually not as good as original equipment. We should keep our original equipment as best as we can in as good a shape as we can. The original equipment hold no risks. Rehabilitation after surgery takes a long time, costs a lot of money. There's always co-payments and deductibles to be made. An ounce of prevention is worth a pound of cure. But the osteoarthritis is a serious condition. But your choice can accelerate it or perhaps halt it. Now, one of the things that people frequently take with osteoarthritis, the common arthritis, or other joint aches and pains, sprains and strains, swelling, which is a part of the inflammatory process, very often we resort to non-steroidal anti-inflammatory drugs, which are very effective. But non-steroidal anti-inflammatory drugs, common over-the-counter drugs or prescription drugs, have been shown to increase blood pressure, have been shown to be implicated in heart problems, and actually even medical doctors, physical therapists, chiropractors are trying to do alternative methods rather than actually jumping to NSAIDs, the non-steroidal anti-inflammatory drugs, as the first line of defense against inflammation and against joint aches and pains. In 1984, the Journal of the American Medical Association showed that NSAIDs do kill the pain, but these drugs accelerate joint destruction by changing joint metabolism. Many people are only concerned with pain. They want the pain to go away. They take different approaches to that pain. And in the short term, certain medications or approaches may be good to stop that pain, but in the long term can add to osteoarthritic degeneration. Now, we should do what we can to prevent osteoarthritic degeneration naturally. Of course, that's the name of the show, Good Health Naturally. Vitamins, supplements, proper exercise, a chiropractor, a massage therapist, a physical therapist. Because even if you did nothing, if you have arthritis and you did nothing, the body adapts. And if I, for instance, pinch myself over time, I could actually cause necrosis or death of that tissue if I pinch long enough and hard enough. But over time, as I speak to you, my sensation of that pinch goes down. The body adapts. Perhaps you've woken up early on a Saturday morning, you go outside, the sun is already up, and the bright sun at first makes us blink. It takes a moment for our eyes to adapt to that bright light. The body adapts to pain or to any stimulus that we give it. The body adapts. So sometimes people come to an office and they say, oh yeah, I had a stiff neck. Oh, when I was a kid, I had a stiff neck in my 20s. Oh, every time it comes, it gets longer and worser. Well, pain goes away, but it doesn't mean that the problem's been handled. It means that the problem has been adapted to. For you smokers out there, I'm sure many of you, when we were kids when you started smoking, and the first 10 cigarettes that you had, you coughed, threw up. It was horrible. After a while, your body adapted to those cigarettes, and for many people, it's very hard to quit cigarettes. They're so used to smoking, which is acknowledged by everyone to be a bad thing to do, but the body adapts. Pain is not the only indicator of health or disease. Pain is the last thing that comes in a problem. You should address your problems before they become painful. I see my time is running down, so I'm going to run into what you should do if you think you have arthritis. Certainly imaging, x-rays, MRIs, ultrasounds, whatever could be helpful. Blood tests, I would highly recommend a comprehensive blood test because that would indicate the supplements that could be taken to address the blood chemistries that may be awry, but there are certain things you can do for osteoarthritis. One big thing in America is obesity. Obesity, increased weight, increases stress. It increases the mechanical pressure on the joints. The heavier you are, the more important proper alignment it is to slow the progression of the joint degeneration, the joint destruction from the mechanical pressure of weight, of gravity. Lack of exercise allows for joint deterioration through joint atrophy. When we exercise, not only do we get big, strong muscles, but our bones hypertrophy, the cartilage in our joints, if we don't overwhelm the repair process, our cartilage is renewed. Exercise, appropriate exercise, builds bones, muscles, and even joints. Someone who is a total couch potato will have arthritis, just as someone who's fallen off a cliff and had a car accident and played football and baseball and basketball. And if you're going to have arthritis, wouldn't you rather say, boy, I played football, basketball, baseball, and I fell off the mountain, rather than, boy, I got arthritis and all I did was video games my whole life? I would opt for the active life and the memories that would give me, the wins and the losses. But there are nutritional imbalances that lead to arthritis too. Again, pro-inflammation is pro-inflammatory. Anti-inflammation is anti-arthritis. So after that comprehensive blood test, perhaps certain vitamins would be indicated. The most common ones out there are glucosamine sulfate, chondroitin sulfate. 1996, medical doctor Theo Dasakis wrote a book called The Arthritis Cure. And since then, he's revised that book as well. But before taking any vitamin, I recommend those comprehensive blood tests. But in general, glucosamine sulfate, chondroitin sulfate, MSM, they're very often in the same pill, the same vitamin. If you have arthritis and these vitamins are not contraindicated, and by contraindicated, I mean ask your chiropractor, medical doctor, nurse practitioner, physician's assistant, your healthcare practitioner taking care of you. Glucosamine sulfate, chondroitin sulfate, MSM, SAMe, these things help rebuild our joints. Glucosamine in certain studies was shown to be as effective as painkillers. After 30 days, you don't take a glucosamine today and feel better immediately the way drug approaches do. The vitamins take time to work, but glucosamine sulfate, chondroitin sulfate, they're outlined in the book The Arthritis Cure. Came out in 1996, many years ago now. I have it on my bookshelf. Essential fatty acids are anti-inflammatory. Omega-3 essential fatty acids, fish oil, you can put them in the freezer. If you don't like that fish taste, take the omega-3 essential fatty acid supplements. It is anti-inflammatory. Again, all of this health advice is not medical advice. Medical advice is best given to you by your healthcare practitioner, who could tell you if, in your case, there's some type of contraindication to even taking vitamins. Vitamins are usually safe and effective, but that's why a blood test to evaluate you before beginning any regimen or seeing an appropriate healthcare provider, all of the vitamins and supplements I'm telling you to take, you should first investigate with your healthcare practitioner, whoever he or she is. But omega-3 essential fatty acids are anti-inflammatory, and they should help with an arthritic regimen. Antioxidants, I talked about at the top of the show. Antioxidants, free radical damage is linked to arthritis. So ACEs, vitamin A, C, E, selenium, zinc, could be helpful to prevent the ongoing progression of osteoarthritis. SAMe seems to reduce swelling and increase mobility better than ibuprofen or naproxen. And that was indicated in 2002 in the Journal of Family Practice. A lot of supplements do have research behind them that show how effective they are. Again, they're not as quick acting as a medication may be, but over long term, they should be less upsetting to your health and help your body naturally repair itself and get those episodes of inflammation, get them down to a dull roar. In my script, I see time is winding down, but there are multiple vitamins, multiple minerals that help with osteoarthritis and would probably be helpful with the other arthritises as well. Again, see your healthcare practitioner for advice. Boron, niacinamide, bovine cartilage, green-lipped mussel extract, SOD, superoxide dismutase, calcium and magnesium. Very important for women in particular. Take calcium, magnesium, phosphorus, vitamin D, vitamin D3. These things help build bones and build joints. Turmeric is a very popular one right now. Not really a vitamin, but a supplement you can take. You should avoid caffeine, alcohol, and tobacco. All of these things are pro-inflammatory. Juicing is good. Get a pineapple and juice it. The seconds are counting down, so perhaps I'll do another show on supplements for osteoarthritis. As I sign off, I'd like to thank each and every viewer for watching and wish you all good health naturally.